This meeting is being recorded.
This meeting is being recorded, and I'm Sharon Fekete, the host of the Dr. Whisperer, and I'm so happy today to introduce two wonderful people who I met online at the Valspar Executive Luncheon. So we have Monica Bengston and Patrick Bengston, who are both nurse practitioners that own a great company. I actually still have their cards sitting on my desk because I was like, I need your card. This is amazing what you do with urgent house calls. Urgent house calls is literally the best thing that I've heard in such a long time. So welcome to the show.
Thank you.
Thank you.
Glad to be here and introduce our services to the community.
Yeah, we are long overdue with having this conversation because I still can't believe that this isn't the norm, but I'm thrilled that you have decided to do something that you knew was a necessary service for our community. So why don't you both give me a little background on how this all started?
Did you want to start?
No, go ahead.
All right. So both of our backgrounds come from the emergency department. I was a firefighter paramedic for 12 years and an ER nurse for close to 10 years. And since becoming a nurse practitioner, I work in primary care. And throughout my career, worked for very large departments, large healthcare organizations on both primary care and at the hospital. So we hated how medicine was going, where you were just numbers. You know, it was how quickly can we see a patient? How many numbers can we see? How many people can we push through the ER so that we can fill that bed with another patient? And we just felt like medicine was getting lost in the numbers. And so the idea of us coming to your house, it allowed a very personal touch to medicine again. It allowed us to be able to spend the time with patients, answer all their questions, allow them to feel like that they're getting their money's worth out of the cost of medicine, which has skyrocketed throughout the years. And then as a provider, we get to feel like that we've actually cared for people again, as opposed to just this mill of what you see in your primary care or ER today.
Well, yeah. And before we hear from you, Monica, I just want to speak about how I used to feel working in New York at a company that we saw hundreds and hundreds of patients a day. And the actual term was, which is terrible. I'm not proud of it, but I've said it 1,000 times, treat them and street them. And all of our providers felt like this is just not right. This isn't the way we should be doing medicine. But when business gets in the mix and you see maybe the potential to just keep growing as an entity, sometimes the patient care really, really suffers for that. So I'm really glad that you saw a new need and decided to branch out. So Monica, why don't you tell us a little bit about what that decision looked like? Because as somebody who's worked with many physicians and nurse practitioners and PAs through the years, that have what I like to call broken out of corporate. What was that like for you? Because I know it can be very difficult to put on that entrepreneur business hat.
It is and it isn't, because we have so many connections, if you will. It felt like it came together much faster and easier than we anticipated. We had physicians that we've been working with, for years, who were interested in being medical directors, or who also saw this as a huge positive to the local community, if you will. They thought, great, this is a great idea. Oh my gosh, so many people don't want to go into waiting rooms anymore. You see these other people pass you by and you get more frustrated. You're going to be exposed to so many other germs or viruses and whatnot. So they don't want to wait in waiting rooms. So everybody who we've known are like, hey, give me a call. We want to work with you. So getting staff together was actually very easy for us. Everybody we interviewed was like, absolutely, we're jumping on board. And so it came together quite fast for us. And then also just the ins and outs of knowing medicine ourselves. So not having a business person actually open the clinic was also an advantage for us, because we know what we need.
Mm-hmm.
We know what the patients want. We know what the families are anticipating, because we are a medical, we do have, degrees and the knowledge of together 40 years of medical experience.
Mm-hmm.
So that helped out a lot.
And don't let her, try and trick you into thinking that she was just another employee at the hospital. Before that, she opened up her own diabetes clinic from scratch. So this isn't the first time that she is
Not the first rodeo.
Something from scratch like this.
Yeah. I love it. That's great. So I want to talk about the amazing transparency that I've witnessed for what you both do. So I went on the website and I went to prices immediately, because I do believe that if we are going to do medicine differently, we really need to offer more transparency in healthcare. I think that is the way that we're going. And I loved that you really had it very simply mapped out what you do, what you don't do, and how much everything costs. And all of it very, very reasonable. I love that there's also an opportunity for a yearly membership and then a discount for other family members. Because, I'm recruiting right now for a medical office and they don't offer health benefits. So, I think it's great to have these options where, because it might be so overwhelming for somebody to think, oh my God, this is going to cost me a fortune. For you to come to my house, this is like, it's like Beverly Hills kind of stuff, Didn't they have a show, like a show or a doctor?
Yes, they did.
Yeah.
Yes.
So, and it's so great. Everybody wants everything delivered. So why not have their healthcare delivered? So what was that? Did you kind of go back and forth a little bit about being transparent, or was that something you decided from the beginning?
Not from the transparency. I absolutely feel, there's a lot of ifs with medical bills, and you're like, oh gosh, what is it going to be when I get it? What's it going to be delivered to my door, and how much is going to be covered for my insurance or not insurance? Those that don't have insurance, we saw a couple the other day, one family member sick, they have 2 kids, they're a couple, nobody had insurance because they couldn't afford it. So they were like, this is awesome, because they're going to give our cards to everybody they know. They can, even deductibles these days are $3,600 to $5,000 for your deductible. Well, you know what? I don't know when I'm going to go to a doctor again. I just got my thumb open. I need it taken care of. Do I spend $5,000 to go to the emergency room? Well, guess what? Yeah, it's so much cheaper, and it's a one-time cost for them. Now we do give super bills. So at the end of the visit, we can estimate and give you the codes for the visit and any procedures we did or any testing we did. And we email you that super bill, and you can always send it into insurance claims. And a lot of it will go towards deductible costs. And so whatever you spent can go into that. Or out of network providers or urgent care provider type aspect. We also accept those health savings cards, which a lot of people have $2,000-$3,000 on them, and they forget about it, or the flexible spending accounts. If you don't lose those, if you don't use them, you lose them, right?
Yeah, absolutely. I had an FSA at one time, and I used to use it all the time if I was just getting Advil, but I would forget that I had that option, and so did all of my employees at the time. So what has been I'm sure it's been an exciting time to have a business, to have an opportunity to present something great for the community. What has been the best part about it for both of you? And I'll go to you first, Patrick.
It's the best part for us is when we go to a call and we have that experience with the patient, and it's just it's that satisfaction of this is why I got into medicine. This is why. Because you're able to deliver the services that you're trained to do, that you want to do, and that I'm not tied in, because we don't take insurance. We're not tied into what the insurance companies tell us that we have to do. So if and you have that reaction from the patients as well, that we were there and we sat with them for 30 minutes and explained everything. And, everybody gets what they're hoping for out of the medicine. And then on the backside, we see some of the Google reviews come in.
Mm-hmm.
And I know that, someone appreciated me enough to put that Google review up for us. And I'm the one that did that,
Yeah.
It's that, direct feedback that's been great.
Yeah. And you, Monica?
It's the convenience of everything. So the whole, why did you get room service? Because I didn't want to have to go out, wait, do the crowd, wait for the food, have to do all that. Well, we have an x-ray service that comes to you and does your chest x-ray. We have a pharmacy that can deliver your medications. You have the providers that are delivering the care. So it's like all in one inclusive care that everybody's like, oh, geez, this is so great. And it's at a reasonable cost, still so much cheaper than going to an urgent care and emergency room.
So why don't you tell us a little bit about because there's been some great technology improvements through the years with being able to provide quality care by having something mobile. I'm sure there are a lot of people out there that don't even realize that you can do an x-ray. I mean, I know it because I'm in the industry, but I'm sure there's tons of people that don't even understand what you can actually provide. So why don't you share a little bit about that?
So our x-ray company, imaging company, they do x-ray and ultrasound. So, there's just like any hospital visit, any skilled nursing, there's the mobile x-ray company. We put the order in about 3 to 4 hours or so later. They're able to arrive from the time that I put the order in. It gets read by the radiologist. Within the hour, they send us the results. I also get a phone call from them if there's any critical results. And so it's real-time feedback. And so it's not something that you're waiting for days for. Also, because we don't take insurance, it frees us up from the charting and prior authorization to get all this stuff done. So you're not waiting days for you to go to a radiology appointment to finally get your chest x-ray done, or you fell and you injured your wrist. Well, we want to be able to determine that, get your referral as soon as we can. But at the same time, we don't have to go see you, fill out a chart, submit it to the insurance company, wait for them to okay it, and then send them out. So it's a very streamlined process.
Yeah, I mean, and think of the cost saving for you as the employer, not having to have people that work on referrals and getting the prior authorizations. I mean, everything is streamlined. So that's wonderful. Monica, is there anything else that you offer in terms of technology that the patient should know about?
A lot of it is just the communication aspect with our phones or via emails. People nowadays don't pick up the phone as much. So you can go directly onto the website and book an appointment, and we'll call you up and be like, hey, I see that you made a call or, a visit request for an hour from now. Let's do a telemedicine call, see what's going on. If I can take care of it on the telemedicine call, then great, because I've done some rashes where, I need to look a little bit further. I need to see you. I need to see if there's an infection that needs to be open, because we do, unfortunate abscess opening, or even the suturing or stapling. And people are like, what? You can come to my house for that? I went on Friday. My buddy's cut his thumb on a boat, and we're in his backyard. He's like, this is so awesome. He's like, I can't believe that. He goes, I don't have to go to the waiting room. He's like, I can stay right here. And he was just ecstatic about it. The neighbors were coming over. I mean, it was like a whole thing. We were giving cards out because guess what? He got injured 2 hours before that. He cleaned it. They reached out, asked for a visit. Is this something you do? And I was like, absolutely. Been doing it for 10 or 11 years in the emergency room. Yes, we can sew you up.
Now we're doing it poolside.
Yeah,
I love it.
Right next to the pool. Yeah.
Poolside medicine.
Yes, it was right. And I wanted to jump in. I was like, this is a beautiful backyard. Can we stay?
Oh, that's awesome. Well, it is so ironic. Do you do weekend hours?
Absolutely. Well, we do 9 to 9 every day. Every day.
Oh,
of the week.
wow. Okay. Silly me. So, I mean, we just had an experience where we had to take my mother-in-law to an urgent care.
Okay.
Well, it wasn't me, actually, it was my husband. And I wasn't around. Usually I get the phone call first, like, where should I go? But he knew I did like this one place that does medicine a little bit different than everybody else. And, you know, I know for sure it would have been a much smoother ride had there been no ride involved, because it was,
Right.
it was her foot and getting her to walk to the car when she was already in pain and then walk into the office. I mean, the convenience of that alone.
Yeah.
And now with everybody, going through this pandemic, being so much more cautious, which I think is a good thing, of not, exposing yourself as much to all of the germs and potential viruses that could be floating around out there. So it's wonderful. And you also have other nurse practitioners on board. Do you have PAs, or is it all NP?
No, we have 2 other PAs and 1 other nurse practitioner. So there's 5 of what they call APPs, the advanced practice providers, and then our medical director, who he will see some people, but he's more or less for us to reach out to if we needed it, for any reason. But we do have the ability to say, you know what, you're too sick. I think you do need to go to the emergency room. I mean, we can identify. And we get a lot of people that don't understand, you on this social media, you try to advertise and people would be like, wait a minute, this is dangerous. Why would you do this? And, we respond with, you know what, I'm not sure you understand our services. We have professional providers that have been working for years, who have the experience to come out and look at you and assess the situation. And that's not being dangerous. That's actually being very safe. Let's evaluate what's our differential diagnosis here. What are you taking? What are you not taking? It's a full, like if you walked into the ER and saw me, I'm doing the same thing, but guess what? Poolside.
Poolside. I love it. That's amazing.
At the end, we're trying to make medicine accessible again.
Yeah.
It's do you drive and go to the ER or the urgent care and wait for 3 to 4 hours to get your care, or do you call your primary care physician and it's going to be a week before you finally get in to see your primary care?
We're not trying to take away your primary care or your other providers. We're trying to provide a convenience, and so if you can't get it, we had a family that couldn't get into their primary and they for 2 or 3 weeks, and they were sick, and we were there in an hour. Let me tell you the reviews we got,
I bet. And that is the reality. I mean, every practice today, especially primary care, they're so difficult to get an appointment. And if you're sick, the last thing you want to do is wait. So to have that convenience is so fantastic. I'm so excited. So for all of you that are listening or watching that are not in Tampa Bay, sorry about your luck. We don't have this outside of Tampa Bay right now. I'm sure, they'll start popping up. My best friend in New York is a nurse practitioner. I've always been such a fan. When I go to a medical practice today for myself, I'm always asking for a nurse practitioner. I think it's a different quality of care. Nothing to say negative, of course, towards our physicians, but I think sometimes having that background with nursing and spending maybe a little more time, and it's just a different type of visit. So do you, for the nurse practitioners that are listening or watching and thinking about doing something like this themselves, it goes state by state, I assume, the laws that are in place for whether or not you're allowed to open up your own practice. Can you speak on the business side a little bit?
Sure. So even if you're an independent nurse practitioner, which it's, once again, dependent state by state, it's not, we don't federally have independent abilities to practice right now. Monica does. At any given time, she could run her own shop. but there are still limitations to us. We're not allowed to oversee other people. So she could be her one-stop shop where it's just her, but wouldn't be able to bring on other providers. So, on the business side of it, we didn't need per se a medical director for us to do what we wanted to do, but for us to expand, to make the business what we wanted it to be, we need that oversight. And in the end, it's not awful,
It's great.
Finding other medical professionals that you get along with, that no one can do this by themselves. You need that team aspect. And everyone kind of brings something a little bit different to this. I can say by us doing the private pay, as opposed to taking insurance, it freed us up immensely with what our abilities are when it comes to regulatory standards, what we needed to have, what we didn't need to have, the not the fines, but the taxes, so to say, on everything that has to go to the state for just setting up the practice was knocked down significantly. So there's an aspect that we are going to be missing out on those people that are Medicare patients, and this is all they can afford. We're not going to be for everybody, but there is a large population that we are going to be able to service. So, on the business side of it, there's a little bit of give and take on the patients that we're going to bring into the practice as opposed to those that aren't interested.
Yeah, no, I think it's fantastic. I'm so excited. Now for my own family, that's what I'll be doing. Yeah, really, we want everything delivered today. I want everything delivered if I can have it.
Your groceries come to the door now.
It's wonderful. So how many people are in the business right now in the practice? How many other providers? Six
total.
And you are St. Pete, all of Pinellas?
And honestly, if you need help, we will try and make do. So
he went to Fort Myers the other day.
We had someone call us up. She was needed help. And basically it was just, can you please come help? I'm like, listen, if you need help, I'm coming. It's going to take me some time, but I'll be there.
And we're honest on the website. If it's out of our district, there may be a fee added to it. But when people, again, she didn't have insurance, she's like, yes, please, I will pay for the travel time. It just comes down to, we'll see how many demands we have in that area, or Sarasota, or, West Chase. There's areas that are reaching out to us because they're finding it, and we're going to look for providers in those areas. So, we go all through Tampa, up Clearwater, Largo.
Up to Spring Hill, which is another hour north of us.
Yeah.
So as we grow and as our name, our brand gets out there, we're going to expand as well. So, out to Orlando, down to Naples. And so we're going to put where the need is.
Yeah,
because
absolutely.
We know it's there.
Yeah. And it's the entire family. I have worked in pediatric clinics. I've done pediatric ER, specifically Johns Hopkins, for 4 years or more. And so, a lot of the providers have done emergency medicine or are still working in emergency medicine, which sees the entire family as well. So they're very comfortable and familiar with kids all the way through adulthood.
That's fantastic. Well, everybody, welcome to 2022. Thank goodness. Thank goodness. We finally have healthcare that can be delivered right to our house. It's really, really wonderful. I'm so glad that you're here in Tampa Bay, and I'm sure that many other people will be reaching out. So you better get some more providers to help you out, because you're going to be driving all over the place. You're going to need like one of those small little cars with the gas money that it is right now, right? My goodness. We'll all, for everybody that wants to give you gas cards.
Right. There you go.
Yes. Even more valuable these days, right?
Exactly. Well, thank you so much for being here. All of the information to get in touch with these wonderful providers will be in the show notes. And thank you for joining us today.
I appreciate it.
Thank you so much.
Thank you. So don't forget, if you mention that you've seen the show or listened to it on the podcast, mention Thai Technology and you will get 3 months for free.